Today we're going to be talking about RAMIPRIL, a medication that is used to treat high blood pressure and heart failure. RAMIPRIL is an angiotensin-converting enzyme, ACE, inhibitor. It works by blocking the production of a hormone called angiotensin-2, which causes blood vessels to narrow and blood pressure to increase. By blocking the production of this hormone, RAMIPRIL helps to relax blood vessels and lower blood pressure. RAMIPRIL is commonly used to treat high blood pressure, but it can also be used to treat heart failure and to prevent heart attacks and strokes in people who are at high risk. Common side effects of RAMIPRIL. The most common side effects are dizziness, headache, and a cough. These side effects usually go away within a few days of starting the medication. There are also some more serious side effects to be aware of, such as fainting, chest pain, and difficulty breathing. If you experience any of these side effects, it's important to contact your doctor right away. Finally, here are a few tips for taking RAMIPRIL. Take the medication exactly as prescribed by your doctor. Don't stop taking the medication without talking to your doctor first. If you miss a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take your next dose at the regular time. Make sure to drink plenty of water while taking RAMIPRIL, as it can cause your body to lose too much fluid.